You're listening to Health Professional Radio. My guests today join me to talk about something that each of them are passionate about. Bill van Nierop from the Lung Foundation Australia is joining us to talk about the Long Kayak for lungs, and Mick Foley, founding scientist with Adelta, is here to talk to us about why the sponsorship relation and what it is that Adelta does that ties in. First of all, Mick, welcome to the program.
Thank you very much. Nice to be here.
Thank you.
Now, first of all, Mick, tell us what Adelta does and why you have an interest in idiopathic pulmonary fibrosis.
So Adelta is a biotechnology company based in Melbourne, and it was spun off from a cooperative research centre, and we have a technology which is really single-domain antibodies. We developed them from the shark, and these antibodies are much smaller than normal traditional antibodies. And the target that we're looking at is actually a very important target in pulmonary fibrosis. So we've done a lot of work, a lot of preclinical data showing that the antibody that we have is able to block the function of this particular molecular target, which is very important in pulmonary fibrosis. So, the data that we have seems to indicate that if you block this target using our antibody, you're able to prevent the progression of pulmonary fibrosis, at least in mouse models. And what we're trying to do now is to commercialize this and basically try and do a human trial.
It's always a long journey for new pharmaceuticals. You say this is working in test tubes and mouse models. What has to happen before the human trials can get underway?
So we need to manufacture this, which does take some time and quite a bit of money. And we need to do some basic toxicology studies to show that it's not going to be toxic when we put this into people. But given that it's a biological molecule, the chances of toxicity are much less than if it was a small chemical, for example. But so there's those two major things before we test it in humans, and we're really trying to do that as fast as possible. But like you say, it does take a bit of time.
And Bill, in Australia generally, do you find there's a lot of support for this sort of research, or do you think you'll get driven overseas to get research dollars?
There's a lack of research in Australia because recent surveys would suggest and confirm that in Australia we look much more harshly at lung disease than they do overseas. So there's a lack of community interest in it, and the impact of that is that you just can't get research funding.
How did you get interested in idiopathic pulmonary fibrosis?
I haven't. I was diagnosed in 2015 with IPF, Idiopathic Pulmonary Fibrosis, and it didn't take long to recognise the stigma attached to it.
And what is that stigma?
The stigma is that it's basically a smoker's disease. So if you tell somebody you have a coronary issue or heart attack or had whatever, you are more than likely to get quite an empathetic hearing and caring, etc. When I tell people I've got a lung disease, the answer is, so you're a smoker then. So there's a lot of people sitting with a lung disease out there that actually have this real sense of guilt and shame.
Yes, and of course the anti-smoking campaigns have promoted that very heavily, which is...
Yes, they have been very successful.
Which is ironic, really, because all the people who have been smokers in their lifetime would say that they were heavily influenced by the advertising campaigns that portrayed it as the only cool way to be hip and with it in the 1960s and 70s.
Yeah, that's true. I mean, it was almost a rite of passage in the 60s or 70s, and I smoked in the 70s, but in my case with a lung biopsy, there was no evidence on my lung that I'd ever had a cigarette. And with lung cancer, particularly in women, over 30% have never seen a cigarette. But that's irrelevant. At the end of the day, why do we talk about the cause when somebody already has it?
Yes. We tend to do that a bit, and that used to be the issue with other things like HIV and other illnesses. There was a stigma to the sin attached rather than a clinical focus on how do we deal with this. Now, Bill, I understand you're off on a long kayak. Is this a paddle for pleasure?
If you ever experienced a lung disease, you would realise that 42 days of 2,200 Ks wouldn't be a lot of pleasure. But it's an amazing river. And I was born and raised on it in another state in Australia. So the journey side of it will be magnificent. The challenge is around having 53% lung function.
So fill us in on where you're going.
We're leaving a place called Albury. I'm here at the moment, and finally it's moved off 6 degrees, which pleases me no end.
Mm-hmm.
And we're going to travel down to a place called Wellington in South Australia. We'll go through 20-odd towns on the way, and it'll take 42 days. So that's the plan. And
this is a fundraising venture, an awareness-raising venture?
Yes, it is. Last year I did a walk of some 700 k's over 15 days to start trying to get the community to engage in a discussion about a disease group that kills 13 to 15,000 Australians a year and gets ignored. And based on some of the success, we raised 100,000 last year, which is enormous in terms of fundraising. But if you look at some of the more popular disease groups, they raise millions. And yet this is one of the second highest killer as a group in Australia. So, yeah, it's about talking to community groups. We've done several interviews and we've got some functions planned on the way where we'll talk to groups on the way.
And Mick's one of the sponsors from Adelta, I gather, given that Adelta's working in this area.
Absolutely. I mean, there's not a lot of people working in this area, but Adelta are, and they've been a very keen supporter of this, for which I'm highly appreciative. It's just every dollar you get, you fight for because it's lungs, trust me.
Yes. A friend of mine who is a lung surgeon once said, if lungs were on the outside, we wouldn't have all these issues. No one would ever start smoking. No one would ever smoke again. But because they're on the inside, it's not such an obvious feature.
But the reality is mine's idiopathic, so cause is unknown. So
yes.
I mean, just show me some empathy. I don't want sympathy, but show me some empathy and understanding. We perpetuate it and we create a real mental issue for people out there with lung disease. I know a 42-year-old woman, mother of two, with an incurable lung cancer, and she hasn't told her greater family because basically she feels it was her fault that her kids won't have a mother to grow up with. Yes,
there's a lot of guilt involved. Now, for anyone who's interested, Bill, in finding out more, the website is www.longkayakforlungs, all one word, .com.au.
Yep.
Is that the best way for people to get in touch with you?
Absolutely, and if they want to get in contact with me, there is a contact page on that website. I actually met with a couple of IPF patients yesterday who had found that and wanted to have a chat and talk with people that understood what they're going through. But yes, and the Lung Foundation Australia as well.
And when you visit those websites, folks, if you happen to find a touch of guilt or a touch of compassion, put your hand on your wallet, not your heart, and help out in a very practical way. Bill, it's been lovely having a chat with you. Thanks for coming on. And Mick, for people who are interested in you and your shark-based research, adelta.com.au is the place where they can reach out to you.
That's right. You can go on the web and have a look at it, and we post regular things up there. And I mean, I just say I think it's amazing to what Bill's doing to kayak on that river anyway. Would be an amazing feat, but to do it while living with pulmonary fibrosis is quite an incredible feat. So I think as many people as possible should support them and be aware that this thing does exist. And there are a few people in Australia. The Alfred Hospital, for example, is a great lung disease unit. But like Bill said, there's just not an awful lot of them throughout Australia.
Yes, and we don't condemn people having knee replacements because they played football in their youth, and nor should we attribute lung disease to people's behaviour in their youth. So I wish you both well, and particularly Bill on your endeavours. Good luck with all that paddling, and as you say, it's nice chilly water. So I'm glad it's you going near it and not me.
Thank you very much, and thanks for the opportunity.
It's been a pleasure having you both with me. If you've just joined us on Health Professional Radio, then you've just missed my chat with two guests. I've been talking with Bill van Nierop, and we've been talking with him about the Long Kayak for Lungs, a 42-day, 2,200-kilometre charity kayak. Bill's doing that. He's doing the paddling, and Bill is a sufferer of Idiopathic Pulmonary Fibrosis, IPF, a lung disease. And so you can imagine the challenge involved. And we've been talking with one of his sponsors as well, Mick Foley. Mick's the founding scientist at Delta, who is a research and science company who have discovered some remarkable molecules in sharks, which they're developing for its ability to block fibrosis and treat fibrosis, including idiopathic pulmonary fibrosis. So both of them are fascinating guys. Now, if you'd like to know more, on our website, we have a transcript of this interview. We also have a podcast available on iTunes, YouTube, and SoundCloud, where you can download the whole interview again. So if you've just joined us, you haven't really missed it. You'll just have to go looking for it. But it's there as a podcast for you to download at your leisure. You're listening to Health Professional Radio. My name is Wayne Buckler.